Hi everybody, Dr. Keegan Conrad here. Today I'd like to share with you the different modalities, the different techniques that I use in both manual therapy as well as energy medicine in order to clear out sinus congestion. I find that there are useful ways to use manual therapy in order to clear out your sinuses, in order to stimulate more flow and drainage within your sinuses. But also if you are experiencing chronic sinusitis, if you're experiencing chronic sinus congestion, there can be emotional correlations that we will talk about closer to the end of this video. I will create a boundary within the video for those of you that would like to just stick to the physical stuff. You can just stick to the physical stuff, and for those of you that want to delve deeper, I'll let you know when we get there and we'll transition into that part of the video. But for now, let's talk about the manual therapy things that you can do to help drain out your sinuses if you're feeling congested after the common cold or dealing with allergies or whatever may be going on for you. You can always tap the regions over top your sinuses in your skull with your fingertips. Frontal sinuses are easiest to access right around the eyebrows here. You're also stimulating the bladder meridian. Bladder 2 would be a point that an acupuncturist would use to help drain out your sinuses as well. But you're just concussing all across the tops and right in between your eyebrows with your fingertips. You can hit with a couple of pounds of pressure here. You could do about 2 pounds of pressure. You don't want to hurt yourself, but you do want to use enough force that you feel it start to reverberate into your skull a little bit. About 30 seconds here. Then we move on to the area over top your cheekbones. We want to stimulate the zygomatic fascia here. We tap on top of and around the cheekbones. An acupuncturist would also put a needle in roughly around these areas to stimulate stomach 3, again to drain out the sinuses. But in your case, we're just stimulating this area to help those sinuses drain, to help that fluid, that stuck mucus inside those sinuses, feel like it can free up and drain out. About 30 seconds here. Then we come to the maxillary sinuses around large intestine 20. So the base of the nose here, right at the base of the nostril, you want to be aiming down towards your teeth, okay? I like to use a couple of fingers and I'll tap down in this direction. This is one of the larger sinuses, so you'll likely get a lot more movement here. Again, 2 to 3 pounds of pressure. You don't want to smack yourself in the face, but you do want to use a little bit of force here. After this, you can take your thumbs and you can sweep the fascia and the musculature underneath your cheekbones here. You want to sweep outwards towards your ears until your thumbs slide off of your cheeks. And you want to do that 3 to 5 times like so. All the way out until they slide off. Yeah? 3 to 5 times. I'm going to do it 3 with you here, and then we're going to move forward. If you want to do more, you can pause the video and do more. Okay. Wonderful. Oh, from here, I like to stimulate some of the deeper sinuses. So your sphenoid as well as your ethmoid sinuses are more in the center of your skull. You can stimulate those by clapping around your ears. This would be similar to a lymphatic drainage protocol in order to drain out the lymphatic fluid around the brain. Yeah? So soft, cupped, relaxed hands, and you want to time clapping around the ears so that you're landing at the same time. You want those forces to reverberate and meet in the center of your skull at the same time. About 30 seconds here. Right now I'm doing it at about 10 seconds, but I'm going to stop there so that we can move forward with the video. If you want to spend more time, spend a bit more time in those areas. Again, pause and spend a bit more time in those areas. From here, I like to work on the lymphatic system a little bit, work on more of the surface stuff that's going on because it helps with drainage of both the sinuses as well as the lymphatic and the glymphatic system. So what I'll do is I'll take my fingertips and I'll do little tiny circles all around the face. All around the face. You can also clap around the face if you want to. Same as how we were doing earlier with your fingertips. You just do it with your hands here. Again, soft hands. Relax your hands anytime that you're clapping, anytime that you're cupping these areas. You want to be cupping your hands. You want them to be relaxed. I'll also spend some time underneath the jaw draining out towards the side and down the neck towards the collarbone, and clap on top of the collarbone. All of the lymphatic fluid in your body drains into your subclavian veins underneath your collarbones. So you want to make sure that you're stimulating these pathways all the way down to the collarbone. Yeah? I'll clap underneath the chin a little bit, down the side of the neck. You want to avoid concussing the thyroid cartilage. You want to avoid clapping on top of your thyroid cartilage, your Adam's apple, your Eve's apple, and again, then we're at the collarbone at the end. And little tiny circles, you want to not drag, but stick and move your skin across the surface of the body. That's the best way to stimulate lymphatic fluid. You can also do this in the mornings in general. I have found that as I've been doing this for the past 6 months or so, the shape of my face has changed pretty significantly, and that's pretty cool. I must have had some significant lymphatic stagnation from earlier periods of my life around my jaw, because my jaw has changed recently. So you can do this for when you're feeling congested. This is pretty gentle though, so you could do it every day if you wanted to. If you like it, do it every day. I find that especially when I'm clapping around the ears, although I do a little bit of a lymphatic drainage protocol for my whole body, but especially when I'm clapping around the ears, if I do that first thing in the morning, it helps me a lot with my mental clarity. Little tiny circles all the way down until we get to the collarbone. Now, I would recommend at this point, I'm not going to share it with you because it's not my line of work, but I would recommend looking up on YouTube. There's a little 3-minute, 50-second video by Stop Chasing Pain, Dr. Perry Nicholston, I believe. He calls it the Big Six Lymphatic Protocol. From where we are now, you could pick up and do a very short, full-body lymphatic cleanse. That may also be beneficial for you with some bouncing at the end. If you don't want to do a full-body lymphatic cleanse, I may still recommend getting out and doing some bouncing if you have healthy ankles and healthy knees, or sitting on a vibration plate if you don't, in order to get more movement, more shaking in these areas can help those sinuses drain out. This is our boundary. From here, I'm going to move on to more energy medicine-based techniques, more emotional correlations, so that we can clear out things like chronic sinus congestion. And if we can continue with this over time, this is something that in my life I have noticed has even changed the resonance of my voice. But if you're not interested in the energy stuff, this is your moment. It's okay for you to leave here. I'm not attached to whether or not you stay. I'm just sharing the information that's helped me in my life and for my patients that come to see me. Okay, so we're on to the energy medicine component of this video. Apologies for the pause and the reset. My constitution is water in traditional Chinese medicine, and well, I live in Florida, and today is a scorcher. I needed to take a little break in the AC and get some water before continuing with you here. So, we're talking about the emotional correlations to do with the sinuses. I'm going to mention a few different energy work techniques here today. We're going to be talking a little bit about Creative Emotional Wizardry by Dr. Randall Roberts out in Las Vegas, Nevada. The man is a wizard. If you are an energy work or an applied kinesiology practitioner, I would definitely look into his work, especially if you've studied the emotion code. I would think of it like a massive expansion on the emotion code with some interlaced other things that both he has invented as well as drawn from other techniques. He was one of the inspirations in my life that drew me towards doing something very similar, drawing in a lot of pieces of information from lots of different techniques and innovating my own things that I'm finding that work on top of that with myself and with my patients, the things that I find that work. And the other individual who made me think about that, think about life and working with individuals that way, is Dr. Richard Bartlett. We'll be using some of his work, MED, Master Energy Dynamics, just a little piece of it to help get the energy moving here and engage different brain pathways to do with the traditional Chinese medicine meridian systems, as well as I may mention thought field therapy as sort of an indirect piece here, but let's get moving, yeah? In Creative Emotional Wizardry, the sinuses, which he uses as a reference point, a sensory reference over top the cheeks, are related to the emotion of regret. So, much like in any muscle testing technique, You can use a little ringlet between your thumb and your forefinger in order to get more information if you're not sure about whether or not the emotion of regret works for you right now. First, you want to make sure that you're testable. The easiest way that you can do that in applied kinesiology is to try to, again, you want this to be as relaxed as possible. You don't want there to be any blanching or whitening of the fingertips. You want your fingers to just rest gently against one another here. And you're going to press and try to break through really lightly, about 2 pounds of pressure. Yeah, you don't want to try to force it. Then you're going to press a point here between your eyes. This is called the master point in applied kinesiology, or yin tong in traditional Chinese medicine. And then you're going to try to break through again. And notice it goes weak quite easily for me. That means you're testable and you can progress forward. You can also utilize different skills like saying, can you show me what a yes looks like? And gently try to break it. Can you show me what a no looks like? And gently try to break it. And notice for me it goes weak. You can also reference your name and say, my name is Keegan. And it becomes strong. My name is Billy Bob. And it goes weak. So there's lots of different ways to make sure that you're online and testable within your own nervous system. I find being regulated and at ease is useful if you would like to, and you feel like you're a little bit ramped up and stressed right now. That's not the best time to do an emotional release. I would recommend doing some breath work. So maybe pausing the video here and finding a breathwork video that looks good for you online. I really like in the morning, sometimes I'll do Wim Hof breath work. If it's the morning for you, that's not a bad idea. It can bring some more vitality to your day. If you're closer to the evening, you might consider, it's with an O, awaken breath work can be quite nice. That's a little bit more gentle. So then we can work towards what we're doing here with how do we begin to recognize and release this emotion of regret to do with our sinus congestion within our system. As a reference for you, I do this for my patients in the clinic. I've done this for myself as well as my patients in the clinic, and I have found, especially for me, but also for other individuals who suffered with allergies and in some cases post-common cold, post-COVID long-term congestion, this can help clear things out, as well as just chronic lifelong congestion. I was a sufferer of chronic lifelong congestion when I was younger. I had a very nasally voice. And the more that I've cleared out patterns of regret in my life, the more resonant and deeper my vocal tone has actually gotten over time. That's my own experience. I've also had many of my patients reference and say, yes, my sinus congestion has gone down the more that you've worked on these emotional patterns, as well as some of the other neurological stuff that I do in the office that I can't share here because it is patented. Yeah? Not by me, by other techniques, which is why I can't share it here. But if you're interested, you can look in the description box below and you can set up a session with me in person, and I'd be happy to see you in Florida. Yeah. I could also consider potentially seeing you for a virtual session, although I cannot guarantee the results of a virtual session. I have had many of my mentors, as well as many clients who I've seen virtually, see incredible results, but I find that it's also far less reliable. So it would be much better for you to just come and see me in person if you're interested in something like that. So for now, you want to make sure that you're testable first. You want to make sure that you have some way of noticing that you're testable, whether it's the master point, yin tong, whether it's show me a yes, show me a no, or whether it's my name is whatever your name is, my name is something else that is not your name, and it should go weak. Yeah? Pardon me, energy is already moving. That's a good sign of that. Burping, yawning, big deep breaths that are not intentional, like that, are a good sign that we're already getting some energy to move, and we're moving more into parasympathetic here. I'm also going to use a different technique that I have not referenced so far called My Liquid Fish by my mentor Jimmy, and I'm just going to make sure that everyone involved right now is clear. They are unclear. We're going to work on that. They are unclear. Wonderful. They are upright and running forward. Let's do that. They're upright and running forward. Wonderful. Okay. So now we can progress forward, and the test that you want to do, if you swipe the cheeks and there's something going on to do with the emotion of regret, your test will become weak. That's how you know. Right now, this is weak for me. There's something that I already kind of know about in my mind that I'm not sure if was a good decision, And I think that it genuinely was, but it's also recently on my mind, and I'm a little nervous about it. So it's showing up under regret because I'm like, I don't know if that was the best thing to do, but I felt like I had to. So sometimes you got to do what you got to do. Let's see, take initiative, right? That's important. Be bold. Take massive action, as Tony Robbins would say. But yeah, if you swipe the cheeks and it becomes weak, then you're working with an emotional correlation within the body. I'm not going to use the techniques that we've talked about. I'm not going to use someone else's techniques to get you to release this emotion. I'm going to show you things that are not based off of any one individual technique so that we can reroute this and we can just make this our own unique process today. Yeah? So if weakness shows up and you can think about something in your life where it's like, yeah, I do feel regret about that, and that can take some self-honesty, but if you can think about it, then you can sweep the area and think about it, and it will become strong if that's what we're looking for. If you're not sure, then you can also ask about ages, and you can say, is there an emotion of regret that I'm ready to release at this moment in time? And test. Did that occur at ages 0 to 10, ages 10 to 20, ages 20 to 30, and I'm 30, so I know that that's because I'm 30, but let's give you a reference here, and let's say, how would you do this? And you would say, okay, was it ages 20 to 25? No. Was it ages 25 to 30? Yes. Okay, was it age 25? No. 26? No. 27? No. 28? No. 30? Yes, so for me it's 30, but that's how you can scan and find the age, and then see, can I think back and remember that time where I experienced that regret? And again, I sweep the cheeks, and while I'm thinking about that moment of regret, the test should become strong. So I know that I'm at the right area. I know that I'm finding the right region within my neurological map of this emotion and where in my timeline that emotion got stuck and was unable to be properly processed, potentially leading to chronic sinus congestion. Right now I feel a little bit stuffy because I'm working with this thing that honestly I just did like an hour ago. So we'll see how it goes. Wish me luck. But yes, how can we then get this emotion to flow? My reference to you, I'm going to use two references. In thought field therapy, they would call this point the Gamut point, but in traditional Chinese medicine, it is its own acupuncture point. So I'm just going to reference it to you as its own acupuncture point. In the webbing of your fingers, between your pinky finger and your ring finger, lies the acupuncture point Triple Heater 2. Triple Heater 2 is about drawing heat, swelling, and mental chatter from the mind, drawing fire from the mind towards all of the different corners of the body, mind, and spirit. It encourages flow within areas that are stuck within the head and neck, would be another way to say that. Now in Jinshin Jutsu, which is a Japanese meridian-based healing art, each of the 5 fingers are related to a specific element. Also, in traditional Chinese medicine, each of the meridians in the body are related towards specific elements. In Jinshin Jutsu, the fire element is represented by the pinky finger, and the triple heater meridian, which originates at the corner of the eyebrow and ends at the outer corner of the ring finger, is also a fire-based meridian. So we're going to tonify this meridian by pressing our pinky finger into Triple Heater 2. And you want to do this on both sides as you're thinking about this emotion of regret. Little tiny bits of motion here, little tiny bits of motion here, and you're going to take your eyes and bring them down and to the right, up and to the left, down and to the left, up and to the right, and tap the back of the crown and tap the front of the crown. And take a big breath and notice what you notice in your body. The eye motions were a little bit of Dr. Richard Bartlett's MED. You may find yourself, like I'm doing right now, my body is swaying a little bit. My vision is also a little bit blurry, and it looks like my eyes are becoming a little glassy. So something is moving. I'm starting to get a little bit of wateriness in my eyes also. You may find yourself taking deep breaths. You may find yourself needing to yawn. You may find your body wiggling and waving. Or You may genuinely release tears. All of these are signs that an emotion is coming to be released within your system. And when you notice what it is that you're noticing, and you notice it calm down, like so, my body is beginning to move less. And this was pretty immediate for me right now. Hopefully it is for you as well. Let's do a little bit more energy work to make sure that that flows for you a bit more easily here. Good. Then you come back to making a ringlet, making sure that you're testable. Again, you can press here and it should go weak. You can say, show me a yes, show me a no, and it should go weak. Or you can say your name. My name is Keegan, my name is Billy Bob. And on Billy Bob it goes weak, so I know I'm still testable. Then I come through and again, I sweep the cheekbones and I retest. And now it's strong. Now it's no longer showing up as a stress to my system. That's how I know for certain I've released this trapped emotion of regret that was keeping my sinuses more clogged. It was keeping my brain from being able to properly communicate with my sinuses because my brain recognized that emotional capacity that I didn't feel quite so safe to process as being dangerous. And so it works like a circuit breaker. You know, what is a circuit breaker? A circuit breaker exists at the very end of a wire before it goes into a light or an electronic device. And the purpose behind it is that if too much electricity runs through that wire, then it shuts the light off. It shuts the light off so that too much electricity doesn't run into the light and it doesn't explode and the house doesn't catch on fire. We don't want that. And the same system applies towards different neurological endpoints in the body. So if something is going on where there was too intense of an emotion, there was something that felt unsafe to the body, then it will shut off its communication line. It won't be able to communicate, the brain won't be able to communicate so well with that end destination. In this case, with the sinuses. But if we can clear out that emotion, then we're turning back on. We're effectively turning back on the circuit that allows the brain to be able to communicate with the sinuses and say, oh, these are full. I'm supposed to be draining these out. And then it does it on its own. What we're doing here, what I'm doing here for you, if you experience some kind of relief, this isn't me healing you. This also isn't you healing yourself. This is you allowing your brain to reconnect with these areas of the body so that your body can heal itself, because that's what the body does. The body heals itself. You get a cut and the body heals it on its own as long as it's operating properly. As long as all things are operating on all cylinders, the body heals on its own. And that's what we're helping you to do here today, making sure that your brain's communication with your sinuses are operating properly so that it can heal on its own. You can always come back if you swept and you noticed yawning and you noticed your body moving, or you noticed whatever came up for you. Sometimes burping also does come up. Then you sweep and you notice it's still weak. You can ask, is there another emotion of regret that I need to release here today? And if it's strong, then again, search for it. If it comes to mind and you know what it is, it's the same process. It's the exact same way. Just rewind the video and start to move from there. If you have any questions for me, if you need anything from me, you can either leave them in the comments below, or you can always reach out to me. Always reach out to my email that I leave in the description box below. If you choose to come and see me in person in the clinic, I would love to see you. I am so looking forward to hearing from you, and I am very much excited to speak with you again real soon. All right.